Hey, welcome back, everybody. You know, good vision isn't just about clear sight. It's also about processing and efficiency, and that's where optometric vision therapy comes in.
And Kristin's at Vision Source office of Dr. David Free this morning, learning about how this wonderful option and treatment works. Kristin, what do you have, those glasses? What were those?
Well, I was told that they didn't look that good on me.
They do. I think they look good. Don't listen to Keith. He's a little off today.
Everybody needs an honest friend, so thank you for being that one for me today. Well, the glasses I put aside, but as you all mentioned, I am chatting with Dr. Free today. And thank you so much for having us in your therapy room.
Oh, thank you for coming.
Okay, well, thank you. Well, first of all, let's talk about exactly who needs vision therapy. So give us some examples maybe of how we know that we need this.
A lot of patients that need vision therapy, when patients come into my practice, I will often, if they're kids, if they're in elementary school or junior high, I'll give them a questionnaire that talks about reading symptoms. Are they having double vision? Are they a slow reader? Do they see double when they read?
Okay.
Just basic questions like that. And I always ask them that in the exam room again. Some patients have a lot of symptoms to where they'll have headaches and eye strain. Other patients are just a little slow in reading, a little slower in comprehension. So I try to make an extra point to talk to them about that.
Okay, we have a quiz for you all at home. You didn't know you were going back to school today. So basically, we can test for double vision. You stick your finger out right in front of you, right? Okay, and then what do I do?
Just slowly bring your finger or the tip of a pencil in towards your eyes, and the finger should stay single. You should be able to get all the way to within 2 or 3 inches of your nose before it goes double.
Because I'm good here, but we tested it someone a few minutes ago, and it was about here, and she...
Oh, some patients are double at 10 or 12 or even 24 inches in front of them.
That's when you know you need help.
You're having problems if you're double vision at your reading distance.
Okay,
yes.
So this isn't something necessarily that, you know, you would have surgery for, but there's also a way that you can come in here and you can have therapy on your eyes. What do you do in therapy?
Well, with vision therapy, what we want to do is we want to strengthen, the eye muscles are strong, but we want to coordinate them so they work together better.
Okay.
And so there's a different series of eye exercises we can do for that that's individualized for each patient. But I do that 2 different ways. We can do in-office vision therapy, and in other cases we can often do home therapy where you can do a computer program at home.
Okay, and this home therapy, the DVD, it's just this. So basically, you have the glasses, you go through a computer program, and this home therapy usually takes how long?
You want to work on it 5 days a week, and it will last about 15 minutes a day, and generally it takes about 3 months to complete the whole program.
Okay, but in office, that is what is most effective, of course. Now, the actual therapy, the options are all around us. It's what we're standing on with the directions going here. Tell me exactly what this tape is for.
A lot of kids that have issues with their eye muscles will often have issues with left and rights.
Okay.
And so this on the floor is a maze so that they're able to tell lefts and rights, and we work with them on that, and they work a lot on that at home as well. And they have to know mirror images, but the first step is just lefts and rights, and then we get them working with mirror images, and that helps them know and just have better eye movements.
Okay, doctor, thank you so much, and thank you for letting me wear your goggles today.
Oh, you're welcome.
Fun. Okay, so needless to say, if you all have kids around 2nd grade or so, this is when you really need to start checking this. You know, you need to have them come in, have them tested, but also they have clients come in their 60s who say, hey, do you know what, I've always seen double, or whenever I read, my eyes float around just a little bit, or it takes me forever just to get through one book. So if you have any of these symptoms, it's worth checking out. And this is the only Vision Source location that does offer the vision therapy, and that's at 12th and Peoria, where we are this morning, guys.
All right, some great information. Yes, some folks need to check in on that for sure. Thanks.
And here's where you can check in at Vision Source. They have 10 area locations, including 1223 South Peoria Avenue, 582-7346. Vision Source-Tulsa, OK.com for more information.